Another ongoing subject of contention and debate and heat and fury is the NHI Act, and it's been reported that there has been a compromise on medical schemes, although the degree to which the compromise is real is again not entirely clear. There seems to have been a political agreement between some in the ANC and some in the DA that medical aids will continue to function as they pretty much function now once the NHI Act comes into place, which, as Peter Bruce told me in a conversation, might be 35 years from now, and he was quoting Nicholas Crisp of the Department of Health when he shared that figure with me. There was a news conference earlier today hosted by the Universal Healthcare Access Coalition, where the point was put forward that the compromise on medical schemes, if it genuinely exists, does little to change the fundamental flaws of the NHI plan as is. One of the members of the Universal Healthcare Access Coalition is the Progressive Health Forum, and there Dr Aslam Dasoo joins us now. Aslam, good afternoon to you. Thank you very much for your time.
Good afternoon, John. Thank you for inviting me.
If there is this compromise on medical schemes, does it make anything of a difference?
None at all, and I'm not sure that any compromise is even possible, given the positions of the parties involved, and our absolute belief that you can't tinker with the NHI Act in any way and hope to come out with a better outcome, because the Act is fundamentally flawed, and just allowing medical schemes to function will simply ensure the interests of one party in the whole health system, while throwing the public sector, for example, under the bus. So it's a non-starter, any compromise on the NHI.
When there was discussion and when people in government were being quoted about this supposed compromise, it was said that the medium-term development plan, which we still have to have sight of, was softer on the NHI Act than before discussions began in the GNU clearinghouse, and that there was now a primary focus on improving the public health system, which surely is the sine qua non. It's got to be the first step.
Yeah, one might think so. Except that you can't fix the public health service without changing its fundamental governance. That's what we've got. That's what they've been, tinkering with all these years. And I think it helps to probably just understand the genesis of this NHI, because there was a plan in place, adopted by the first democratic parliament, developed even during the 80s, during the era of the United Democratic Front, in which its health arm, the South African Health Workers Congress, and I remember that time well, developed the original principles of such a plan, adopted by Parliament, started to be rolled out, and then summarily defenestrated, just stopped by the incoming Zuma regime, administration, I should say, and it replaced with this NHI, an uncosted, unresearched, concept. And we were quite stunned at that. And what it did was stop all necessary health reform from that point onwards. For the last 17 years, we've had none, while the government has been focused on retrofitting this NHI, which has now resulted in this act, which is about as insensible as the first propositions around it, and completely unimplementable. And during that period, we've witnessed the deterioration of a public health system that had all the potential to become, world class, and a private sector integrated with it, but which would function pretty much as is, with corrective regulations to offset its unintended consequences. And they completely neglected that for 17 years. And we have what we have now. And you're right, I heard your introduction about the potential implementation of this act. Let's just go through that. So it's predicated on raising taxes, because it's going to eliminate medical schemes and it needs money to replace that. there's no possibility of increasing taxes. It will need to change, I think, a dozen acts of parliament to allow it to be promulgated, and a couple of constitutional amendments. That's highly unlikely to happen in your and my lifetime, just looking at this parliament that we have. And then, of course, there's the very severe litigation that it faces, and who knows how long that will take. And then last, it's predicated, as we read, to be rolled out over many years. One cannot understand why that should be the case. And our proposal that we put forward to the media today is one that's not an alternative. It's in fact what should be happening right now, and it won't stand comparison with the NHI won't stand any comparison with it. It's completely different. What it does is it
Aslam, if I could, yeah, because inevitably time is it's just very, if you could, within 2 minutes.
Sure, I'll try quickly to do that. So what it does is that it picks up from where it was stopped. It aggregates all of the commissions and the research that was commissioned for those various commissions, and puts forward an integrated, synthesized plan, which really is the only one possible at this time. And it's not just us, the founding members, that is the Medical Association, Private Practitioners Forum, and ourselves saying so. 30 organizations have signed up to this, out of the 50 who attended our summit last week, and more are intending to. So I think this is common cause now in the entire health sector. So, we're quite convinced that any sensible government would grab this and start implementing it, because they can, because it doesn't require any more money, doesn't require any major legislative changes. It takes what we have in the private sector, in the public sector, integrates it without threat to anyone, and gives us universal access to care, which is the constitutional entitlement of everyone living in the country in 3 to 5 years.
Yeah, the difficulty with what you've just told me is that 3-word phrase, a sensible government, and it doesn't appear to me that that's what we have at the moment.
We must have hope, John.
No, of course we
But
must.
there's no tinkering with what they've got. And I think these political deal-makings of elite groupings, doesn't do anything for anyone. And we reject that. This must be a public process that they must accept. We have shared it with the government. We've shared this plan with the president, and we got this reply after they consulted with the Ministry of Health, saying the proposals are noted, but the matter is sub judice, which we can't understand. This plan is not being litigated. There's nothing sub judice about it. They can discuss it with us. I think they're referring to the NHI, which this plan has got no reference to. Stuck.
Thank you very much, Dr. Aslam Dasoo, the convener of the Progressive Health Forum.